Good evening, everyone. I want to call to order the Board of Health meeting for June 17th, 2025, in Harwich Town Hall, Don B. Griffith Room. I'm calling the meeting to order. Anybody going to video or audio this meeting has to notify the chair. Is anybody? No? Okay. I think we're good. All right, so you can read off the first thing.
Okay. Reorganization of board members.
All right. All right, so I'm ready. So I'd like to nominate Kevin Dupont for chair.
Seconded.
Vote?
Aye.
Aye? Aye. You can vote.
Aye.
Okay, all right. Or nothing. All right. Do we have to do the others?
Vice chair and clerk.
Okay. Well, I can, you want me to be the vice chair?
Abby?
Huh? I can nominate, I think I'm going to nominate Ron for vice chair.
Ron for vice chair.
I second the nomination.
All right. Vote?
Aye.
Aye?
Aye.
Aye. Yes, all right.
I mean, you've been doing this for a while. You want to be our clerk, help us keep us organized?
No.
Janet? You want to jump in with both feet?
Oh, we could nominate Pam. We can do that even if she's not here.
It's up to whoever you would like clerk to be. If you want Janet to come in
I
with
hate
feet,
to-
if you want Pam to
I
do
know,
it.
it's like your second meeting.
Is
I don't want you to.
Is it like minutes and all of that?
It's just reading the agenda.
Agenda.
Oh, I don't mind that. That's fine. I can read the agenda, for sure.
All right, go ahead.
It's up to you two if you want to do.
Well, I did the
I-
first two.
You up for it, Janet? You want to be hesitant? I mean, we know that she'll do it. So if you're
Okay.
hesitant, we'll.
I wouldn't mind, when is the next election?
Next year.
I did the same thing to her last time. So yeah, don't even hesitate. Just speak up.
Okay.
Okay,
All right, I'll go.
let's go.
All right, so who are you going to nominate?
No, we're nominating. Sorry, Pam.
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 All right.
Second.
Vote?
Aye.
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 All right,
Okay,
done.
Done.
All right.
done.
All right,
All
so
right.
you're
My
it.
feet wet.
Tag.
All right.
Presentation. By-
No, oh, yeah, well, we can let him since,
Yeah, we'll
Pam
keep
isn't here.
keep going for this meeting and we'll change it up for the next meeting.
oh, all
Right.
right, okay.
Don't be that eager to leave. Come on now. Yeah,
They did that to me. It was like, here it is, it's yours. All right, go ahead.
Presentation by Gabrielle Sokolowski, Superintendent of Cape Cod Mosquito Control.
Hi, and you have my PowerPoint? Thanks.
No problem.
It's always the part I worry about the most is how I'm gonna get the PowerPoint to everybody.
You know what? I don't think we shared that with our IT department.
So,
got it in my work email on my phone. I can.
I was gonna say, I have it
Yeah,
on a
real
flash
quick.
drive as well. It's posted on the board's website. The agenda, the whole agenda pack is posted online. So we can screen it that way.
I don't know if you could
This
just
is
send
what,
it
this
to
is
him.
what I worry about. I know.
The
It's
last
better
couple
with
of people have
pictures.
all been online, so I haven't had.
Oh, gotcha.
Sorry about that.
No worries. Thanks for taking care of it. I like it to be able to send it, and then somebody else could show it.
So you'll just wanna go to the, and it should be the first couple pages.
So I can just start?
Sure.
So my name is Gabrielle Sokolowski. I'm the superintendent of Cape Cod Mosquito Control. I'm also an entomologist. I've been at Cape Cod Mosquito Control since 1993. Oh my goodness. So anyway, I've gone from entomologist to assistant superintendent to superintendent. Cape Cod Mosquito Control, I'm just going to give you an overview tonight. So Cape Cod Mosquito Control, it was established in 1930 through legislation. We're the first mosquito control that was organized in the Commonwealth of Massachusetts. We're officially a Commonwealth agency, but we're paid for by our towns. So I figure I work for all of you and the people who live in your towns. So if you want to go to the next slide. We're one of 11 organized mosquito control districts in the Commonwealth of Massachusetts. The mosquito control districts on the eastern side of Massachusetts were the first ones to be formed because of tourism and quality of life issues. If anyone has been through a saltwater mosquito control outbreak, it's not just a nuisance. It's a lot of mosquitoes biting people all day long. We had a situation in Wellfleet a couple years ago. It was an economic issue for the town. It was a quality of life issue for the town, as well as being concerned about disease transmission. Next slide. Again, we're funded by all 15 towns. We have 5 commissioners that sit over the mosquito control. 3 are just local representatives. 1 represents the town officials. We have a town manager on our board. And we also have someone who represents selectmen and town councilors. We have monthly meetings that are public meetings. They're not very interesting, but anybody can attend. We have 27 folks who work at our district, and we are fully staffed year-round. It's a very labor-intensive job. Next slide. So I'd just like to remind people that mosquitoes go through complete metamorphosis. Mosquitoes lay their eggs and develop in standing water. Their eggs are laid around standing water. The larvae hatch in the standing water. Standing water is where mosquitoes come from. We get a lot of calls in the summertime with people who are mowing their grass, for instance, and they insist the mosquitoes are coming from the grass. They originated somewhere in standing water. They're just resting in the grass. And I do think there's a disconnect sometimes between the things that are wriggling in the water and the things that are flying and biting people. So again, it's just a reminder that if you have standing water in your yard, in any case, any little bit of it that sits there for 5 days in the summertime, you'll have mosquitoes laying eggs in that standing water and going through metamorphosis to adults. So you hate to be raising mosquitoes in your yard. Next slide. So we use an integrated management approach to mosquito control here on Cape Cod, and we focus on mosquitoes in their developmental stages. We don't do any spraying at night. A lot of people call us who come from off Cape, who are used to mosquito districts that spray at night. They go around with trucks. They still do that, and they spray an adulticide, something to kill the adult mosquitoes that are flying. We don't do that at Cape Cod Mosquito Control, and we never have. The idea is that, well, by the time they're flying adults, it's too late anyway. But when they're in the water, they're confined to that one location, so you know where to find them. And we have maps of the Cape that were done way back in the 20s, before mosquito control was even organized, where somebody walked the Cape and identified each one of the potential habitats where mosquitoes might develop in our whole county. Each one of those places, there are over 4,000 identified places in Barnstable County. Each one of those places was given a unique identifying number. So we can track what we've done over time, what we found there over time. So in the wintertime, October through April, we're doing water management. Our crews are out digging ditches, opening up pipes, all that sort of thing. As the Cape became developed, what you saw was the natural ways that water used to run were closed off by roads and houses and all sorts of development. The water still has to go somewhere, and I don't want the water to be standing around making mosquito habitat. If we can keep the water moving and we can allow fish and other predators to move through the water, that takes care of a lot of our problem. So we're doing water management through the winter and fall, and then in the spring and April, we switch over to larval surveillance and larvicide applications. So right now our crews are out doing, you can see under the larval surveillance and larvicide applications, you can see one of our crew members, he's got a dipper in his hand. He's just sampling water. They're going to all these locations that have already been identified as potential habitat. They sample the water to see if mosquitoes are present. And then if mosquitoes are present, they apply a larvicide. The product that we use, the majority of the product that we use is a bacteria, BTI, Bacillus thuringiensis israelensis. We put that in the water. It's very specific for mosquitoes. Mosquitoes in their larval stage are filter feeders. They pick up the bacteria, they ingest it, and it creates toxins in their gut that kill the mosquito larvae. Very effective. It's only out in the environment for about 48 hours before it breaks down. So good because it's not accumulating in any way. Good because it's targeted. But that means that you gotta keep going back to these places throughout the summer and checking to make sure that there aren't mosquitoes developing. So we're looking at all sorts of different habitats. We've got about 25 different species of mosquitoes on Cape Cod. Each one is very specific about where they lay their eggs.
How often does the female lay eggs?
As often as she possibly can. It happens, so it depends on the species of mosquito, but yes, they'll continue to lay eggs as long as they have the nutrition and they have a mate, then they will continue to lay eggs until they die. So they may lay eggs a number of times in their life cycle, one female mosquito.
All right.
What's their nutrition?
So the male and female mosquitoes feed on nectar and other sugar sources for energy, and then the female mosquitoes need your blood to develop her eggs. So that's when the disease transmission occurs, when she's going to get the blood for the protein to develop the eggs. And
So
out of the
it's
25,
females-
Go ahead.
Female mosquito that bites you?
only the female mosquito, yes. Out of the 25 species, only a few species are capable of transmitting disease. They're very specific about the habitat where they lay their eggs. So if we get a phone call in the summertime, we get about 300 or 400 phone calls from people around the Cape who are having a mosquito issue. Anyone can call up our office. We send a crew out to your residence, the property that you're concerned with. They'll go around, they'll look for whether there is mosquito habitat around there. Most people assume that it's gonna be like the swamp that's next door, but that's on our maps, and they're going to those swamps and marshes pretty frequently. A lot of times, it's something in their backyard, so we do a lot of education, and the crew will come to the house, and people don't love to hear it, because they really want to tell you it's their neighbor that's creating the problem. I see you nodding. It's always the neighbor, but it's really not always the neighbor. We're also doing the water management, the larvicide applications, education are the three parts of our integrated approach. With any integrated management program, you're also doing surveillance, and so we're doing surveillance throughout the summer to make sure that our program is effective. We have sites where we're doing mosquito control. We also have sites at Cape Cod National Seashore where we're not able to do any control, so we can compare to look at efficacy in different types of habitats. Sorry for the people who live around the habitats that we can't control, but it gives me an idea of how effective the program is. So we're doing mosquito surveillance for efficacy. We're also doing disease surveillance. So the Department of Public Health, the Massachusetts Department of Public Health, does the testing, but they don't do any collecting on Cape Cod. They don't set traps on Cape Cod. So we're doing all of the surveillance on Cape Cod. We are collecting mosquitoes on a weekly basis from different sites. In Harwich, we have now 3 sites, 2 historical sites and 1 that we've started this year, where we're collecting mosquitoes on a weekly basis, sending them into the state labs to test for disease. Mosquitoes go in, this is the first week they're doing testing, so mosquitoes went in today, and by Thursday we get our results, and if I get any positives, I send out that information to all the health agents. The state will call the health agent first, then they'll notify us so that we can just come up with a plan for what we want to do to reduce risk of transmission in an area where there was a positive. Next slide. So in Harwich, we have, I've highlighted the sites that we've gone to in the past 10 years. So all of those red dots are individual sites that our crew visits or has visited in the past 10 years. You can't really see it necessarily on this slide from this distance, but maybe you can see on your printout, some of those actually have black dots in them. The black dots signify the sites that they went to last year where they had to do treatment. It was drought, we're still in kind of drought. So it wasn't all the sites in Harwich that we had to go to, a lot of them were dry. But I think that when I added them up, it was over 130 sites that we were treating regularly and checking in the town of Harwich. And we were at those sites over 600 times in the last year. Yeah, and you can see those 2 stars on there are our trap sites, and we've added 1 more trap site this year, but those are our 2 historic trap sites.
Do you know off the top of your head where the new trap site is?
The new
Just
traps,
an idea on the map.
yeah, the new trap site is off of 124. In the area around the tech school.
Okay, so that side of the highway.
Yes, so, yes. And that started, we sent in submissions this week from Harwich today. Next slide. The two diseases that they're testing for in the Commonwealth of Massachusetts that we're concerned with are Eastern equine encephalitis and West Nile virus. Eastern equine encephalitis is a disease that's natural cycle is mosquito to bird. So the birds come into our area in the springtime. They go through physiological changes where the disease is then activated in their bodies. So the birds bring the disease into the area. The mosquitoes bite the birds, pick up the disease, and then carry it from bird to bird, from bird to mosquito to bird. So it's amplifying in the bird population. And the mosquito that's transmitting that disease to birds, that Culiceta melanura on that slide, that's a bird-biting mosquito. It very rarely bites mammals, humans. So it requires another mosquito species, a bridge vector, to carry the disease from the bird population into the human population. It happens very infrequently. So if you look at the statistics in the Commonwealth, you don't see a lot of cases. It's a very severe disease, though. When people start to have symptoms, it has a high mortality rate. It causes encephalitis in the people who get it. Yeah, and it's a virus. There's not a lot you can do about it once somebody does get it. So we work very hard to keep the mosquito populations down so that you don't have transmission or amplification of this disease. Next slide. The other disease that they're looking for in Massachusetts and they're testing the mosquitoes for that we submit is West Nile virus. That disease is being transmitted. Again, it's being brought into the area in the bird population most likely, and a mosquito will pick up the virus from the birds when it bites the birds and it carries it to another bird. So it's amplifying again in the bird population, and that's part of why you see these diseases more likely at the end of summer, because it takes a while for it to amplify when you see the higher numbers. The mosquito that, oh, go ahead.
Does it affect the birds? Did they die?
Well, so with Eastern equine encephalitis, the other disease, it doesn't impact native birds, but it will cause death for non-native birds. Because it's been in this area for so long, they use, the pheasants would die from it. Emus are very sensitive to it. Birds that aren't native to here are sensitive to it. With West Nile virus, that's much more recently introduced into the United States. When it was first introduced, maybe you remember, the crows were dying. Blue jays are related to crows, so blue jays were dying. Over time, that they've been able to, their populations are not sensitive anymore to West Nile virus. So you really don't see an impact on the bird populations anymore with West Nile virus. They're not sensitive to it. It's been here long enough now that I guess if you were sensitive, you weren't gonna pass those genetics on to,
Yeah.
right?
What are the dead end folks?
So for West Nile virus and Eastern equine encephalitis, mammals are dead-end hosts. So with the cycle, it's a bird brings in the disease and the mosquito carries it to more birds, and it's amplifying in the bird population. Once either of those diseases, this disease or Eastern encephalitis, gets into a mammal, a human, a horse, it's not able to be transmitted again. So that's the end of the disease cycle right there. A mosquito can't bite a person, pick up West Nile virus and carry it to another person. We're dead-end host for that disease. So I guess it's not necessarily where the disease wants to go, but sometimes ends up there. West Nile virus is being transmitted by a mosquito that bites both birds and people. So now this makes it much more likely that people will be exposed to this disease. And based on our data, I would say a lot of people on Cape Cod have already been exposed to West Nile virus. It tends to cause, in the majority of people, very mild symptoms or no symptoms at all, like it's your summer cold. That's not to say that it can't cause severe symptoms. There have been some cases, Maricopa County in Arizona a few years ago had a number of deaths from it. It can cause encephalitis and meningitis, but in general, what you see are milder symptoms, that cold during the summertime. That is West Nile virus. But much more likely to get into the human population. The mosquito that carries this disease is the type of mosquito that lays their eggs in man-made containers, in people's bird bath, in people's gutter, in the buckets. That's where it really likes to lay their eggs, or in something very, very organic. Water sitting in a lot of dead leaves on the tarp, or they like that really organic water, or catch basins. So our crews do go around to the catch basins. The catch basins, you probably all know this, are meant to hold water because you don't want the water to run off the roads with all the pollutants in it and just go into the groundwater. So the catch basins hold water underground. Mosquitoes love the water in catch basins. There's no sun, there's no wind. In the summertime, if you just stomp on a catch basin, the mosquitoes just come flying out of it. Last year we treated about 1,200 catch basins in Harwich, just to keep that down. And we do try to focus, at least at the beginning, what we do is when we start to treat catch basins, which we're starting this time of year, this probably next week, we try to focus on places where people are in the evenings, because this type of mosquito bites in the evening. So we're gonna focus to start with the areas where people might be out in the evenings, where there'd be a concern for disease transmission again. Next slide. So this just to give you an idea of what we submit. So last year in Harwich, because we've just started this year, I thought maybe last year's statistics might give you a better idea of what we do. And it was dry last year for a lot of the season, so I don't know if this is representative of every year, but this is what we submitted last year. We collected 1,267 adult mosquitoes. 16 samples were submitted for testing. So we only submit vector species for testing to the state labs. We pay for every pool of mosquitoes we submit to get tested. So we think about it, the vector species are what goes in. Each one of those samples, when it says 16 samples, contains 5 to 50 mosquitoes. They pool them in these samples, so they'd be a particular species collected at a particular location on a particular day. And we have had no positives for Tripoli or West Nile virus. Yes!
You're doing a good job.
Right? Yes.
That's nice to
That's the
hear.
goal, right there. So next slide. We do unfortunately get both diseases commonly at low levels in Barnstable County. So this is just to give you an idea. The green bars are the West Nile virus. The yellow orangish bars are Eastern equine encephalitis. We do find both diseases in Barnstable County. The Eastern encephalitis, we don't usually find it at as high levels as you see historically in Plymouth and Bristol County, but they have much larger swamps, and that mosquito that's amplifying the disease that I showed you in that one graphic, the Culicina melanura, she lays her eggs and develops in white cedar swamps and red maple swamps. We have them, but they're just not as big as off Cape. So, and we work really hard to keep those numbers low, so we do see them. 2019, Tripoli was high levels across the state, and it's being carried by birds. So we usually start to see cases when we do get mosquitoes that are positive towards the end of the season, or the end of the birds' season for nesting and stuff. They start to move around and congregate, and a lot of them pass through Cape Cod. So we'll get a positive, but it's a bird moving through type of positive. So anyway, that's just to give you an idea of what we found in Barnstable County for disease. Next slide. You can go to the website, the Massachusetts Department of Public Health. This is where we, toward the end of last season, what the levels were for risk for transmission. You can go to your town, you can see what the level of risk for transmission is in your town. Part of it is based on, between the remote and low, is based on historical data as well. So if we'd had a positive last year, for instance, it might be considered at a higher level possibility for the year after. But you can see we're still in the blue. But anybody who's interested can go to these websites. So this is the website for Eastern equine encephalitis. And then the next slide. is the website for West Nile virus. And the only thing I'd note is that, I don't know if you noticed, but on the Eastern equine encephalitis map, they start at remote. With West Nile virus, they start at low. It's really just assumed to be throughout Massachusetts. We're doing surveillance to see what level it's at and to try to manage populations of mosquitoes if we see it in an area where we can manage it. And you can see it tends to be from the Mid-Cape to the Upper Cape where we find it, like this was last year. Like I said before, it's the type of mosquito that lays their eggs in man-made containers, so it tends to be a little more, I'm gonna say urban. That might be a stretch for some of these towns, but it's a little more urban, higher populations, higher concentration of populations, where you have a lot more containers is where you're more likely to see it. So that's why you tend to see it from the Mid-Cape to the Upper Cape. Next slide. Always remind people, personal protection, when you're choosing a repellent, you look at the label, and it's the same as they say for ticks. You check the label to make sure it has an EPA registration number on it. That means that it's been tested to be effective and safe to use on skin. If it doesn't have an EPA registration number on it, it may have on its label, it's natural, whatever. It hasn't been tested for safety on your skin, and it hasn't been tested for efficacy against ticks or mosquitoes. EPA registration number. Just the same things that we always say. You know, I can't believe I have to say this to people, but it's never good to be bitten by mosquitoes. You should avoid that. So if there are a lot of mosquitoes out, you should go inside, put on repellent, wear long sleeves. Yeah. Empty your containers in your yard, because it's probably not your neighbor's, it might be your yard as well. Next slide. Another thing that we've been getting more recently, a lot of calls on, are people who are hiring private companies to come in and take care of their mosquito problem. So I prefer people call us so that we can find a permanent solution. Where are those mosquitoes coming from? What can we do to prevent them? My solution is not going to kill the mosquitoes that are flying today. I'm not spraying something for adult mosquitoes. Those mosquitoes are going to be around. If you call me, my crew will go there. The flying mosquitoes will still be around for a week or two because I'm not killing adult mosquitoes. But it means that you won't have mosquitoes moving forward because we've taken care of where they're coming from. People obviously are going to want mosquitoes taken care of right away. Maybe they have an event. Maybe they want mosquitoes taken care of right away. So I just wanted to make some suggestions. This is what I tell the people who call my office. When you're picking a company to spray your yard for ticks or mosquitoes, you can go to a link at the Department of Agricultural Resources and see if they've had a violation. There are companies on Cape Cod that have had violations. You probably want to know that before you hire them. You can go to a website, again, Department of Agricultural Resources, to see if the person who is applying the pesticide on your yard has an active pesticide applicator's license. You can put in their name and it'll tell you whether they have an active license. You should ask them for a label and safety data sheet. They're putting something on your yard where you're walking, where your kids are playing, where your pets are running around. You should know what they're putting there. And I know I say this, people don't even want to read the label of the bread they're eating, but you should want to know this information. And I would encourage people to become aware of what's being used on their property. And you should ask for that information. There are definitely labels that say things like not to spray when flowers are blooming because it can impact the bees, things like that. You should know that. It's your property. And if you're concerned, and I do get a lot of these calls as well, there's a hotline that you can call, the Pesticide Enforcement Hotline, if you have a complaint. I can't do anything about the complaint. We're not an enforcement agency, but the Department of Agricultural Resources is. So I would encourage people to do that if they feel there's a problem, because I don't think it's going to get better unless somebody calls. So anyway, it's my soapbox. Next slide. That's my contact information, and anybody who's having a mosquito problem or has questions about mosquitoes, or they can call our office, and if you're having a mosquito problem, we'll send out a crew and they'll come and track down where those mosquitoes are coming from and take care of it. Not that they'll all be gone right away. We're not spraying anything into the air. We're gonna track down the source. So that's mosquito control in a nutshell.
Wonderful.
Thanks. Any other questions? Okay.
I'm good.
No, it's one phrase you would use, the amplification, the bird being the amplification kind of vector. It's what, basically what you're saying is like the bird brings it up and then the bird's gotta be here while the mosquitoes start spreading it from
So-
bird to bird, so that the number of mosquitoes potentially carrying it increases.
And the number of birds and the number of mosquitoes, exactly. It's just amplifying in the bird and mosquito population, yes. Cool. All right, I hope nobody needs to call me. Oh, right. And I don't have to report anything to the town of Harwich.
Same.
Thank you.
All right,
Always
yeah,
very
this'll be
informative,
it. See you next year.
See you next year.
Thank you.
There we go, B. Presentation of BNA services by Meg Payne, MBA Director of Public Health Provider Relations in Telehealth, BNA Clinical Administration.
Hello, thanks for having me. So my name's Meg Payne, Director of Public Health and a couple other areas at the VNA of Cape Cod. I did provide you with a folder with the information I'm about to go over, so you can look over that whenever you want. So I've been with the agency for almost 10 years, and well before my time at the VNA, we have always had a contract with the Harwich Health Department to serve as the public health nurses for the town of Harwich. Alongside, I know that you have a private nurse as well, Sue, and we work collaboratively with her. So over the years, our programs and our services have evolved, and I'll kind of do a high-level overview of the things that we offer. I did include some statistics on what we specifically offered in the town of Harwich, too. You can take a look at that. So I'll start with our clinical services. We have an array of clinical services, and we also have non-clinical services. So our clinical services encompass town nurse and town physical therapy visits. These are home visits for people who would not qualify for traditional home care, but they need some type of medical assistance or attention. So we have a nurse and we have a physical therapist. We don't send our nurse out usually. If we get a call like this in the town of Harwich, we will refer to Sue and give her all the information that she needs, and she follows through with an actual visit. We do have a physical therapist. She's also certified in lifestyle medicine. So when she does make home visits, she looks at the whole picture, she looks at the whole environment, and really talks to them, not only about their physical activity and exercise program, or maybe wanting to start one, but she talks about like, what are your goals, and coming up with a plan on how to get there. And she talks about their relationships and quality of their sleep and things that maybe they may not consider when it comes to their health and well-being. In our home visits, and actually in everything that we do, really it's all about education and connection to community resources. So between myself and the department, we are involved in almost every meeting or focus group. I don't know, we're involved in every meeting that I think we possibly can be involved with, and we have a really good pulse on what's available to the community. There are actually a lot of resources available. We're very lucky here in Barnstable County. I think that the issue that we run into a lot is people either aren't aware of these resources or they don't know how to access them. So that's a big piece of what we do when making home visits. I also wanted to mention that our town nurse is a diabetes educator too. We, in addition to town nurse and town physical therapy, we have a maternal child health service. So we will go out and see mothers who are pregnant, and we also see mothers postpartum as well. Again, education, connection to resources. We do a lot of education around mental health. All of our nurses are perinatal mental health certified. They're also certified lactation counselors, so we work very closely with the hospital, maternity, with OB offices, Outer Cape Health, with whoever, just to make sure that people are connected with the resources prior to giving birth so that they can have more positive outcomes and experience. We do partner with an organization called Sharing Kindness, and they are located in Harwich. It's a nonprofit organization whose focus is suicide awareness and grief support. We do partner with them to offer a perinatal loss support group. This has been going on about 3 years now. The group is located in Harwich. We also have a group on Nantucket, and their clinicians are certified in an evidence-based program, an evidence-based model from the Dougie Center. So I just wanted to highlight that. That is, prior to this group starting in about 3 years ago, there was not a group in existence on the Cape. Anyone who was experiencing a loss on the Cape was actually sent to South Shore Hospital for resources. So we're really proud to be able to bring that here. We also have an immunizations division. We do large vaccine clinics, mostly October, November timeframe. We did have one this year at the Senior Center Community Building. We administered 112 vaccines, both flu and COVID. We also do a vaccine for children program at our dentist's office. So we do have Harwich residents who have, usually the situation is they've recently moved here from out of the state or out of the country, and they don't have, they're not established with a pediatrician, and they need certain vaccines in order to attend school. So we get referrals from the school nurses so that we serve as this catch-up service so that the kids can go to school as soon as possible. Within this fiscal year, we've served 8 residents as a catch-up service. Excuse me, that's homebound, sorry. We do homebound vaccines. We did 8 residents who are homebound in need of flu and or COVID. We also will vaccinate any caregiver support system that's in the house as well. So in addition to all of that, we also provide an array of screenings and clinics. Mostly these take place at the senior center. So we do offer blood pressure, cholesterol, skin cancer screenings, oral cancer screenings, fall risk assessments, depression screenings. We have a new program called cardio chats. We're actually working with the hospital right now trying to coordinate doing some screenings as well. So I did, in your packet, there's a lot of information, but I did share that this year we've offered a lot of programs at the senior center. We did offer a depression screening. That was one of the screenings that we did. We did a lot of presentations as well, so that was something else I was going to talk about. We do a lot of education in the community. So we did do a MyChart presentation where we talk to people. They bring in their device of choice, and we talk to them about what is MyChart, why would you use it, what can you do with it, and those have been really successful. So we did one of those in April. We also presented on stroke awareness with one of our physical therapists at the senior center in February. We also did a Diabetes 101 presentation that was really successful and well received. So in addition to presentations, screenings, clinics, we also do exercise programs. We have 2 exercise physiologists on staff with us, and we have an array. You can see in your folders, we have a whole list menu of exercise programs that we offer. And again, in everything that we do, it's education and connection. So though people are coming to attend an exercise program or maybe a vaccine or something like that, we're always, having conversations with people and figuring out, where can we help and where can we fill in the gaps. The last thing I want to mention, we do the communicable disease surveillance and follow-up with the state. We work collaboratively with Barnstable County to be able to support all of the towns on the Cape and Islands for disease investigation. So when Gabby was just speaking about Tripoli and West Nile virus, we see those things, we see those positive results come through our system called MAVEN, which is the Massachusetts Virtual Epidemiologic Network. It's kind of like our software system, our electronic medical record system that we use to communicate with the state. So anytime somebody in the town of Harwich is diagnosed with a reportable disease, tests positive for a reportable disease, we get notified. And then on our end, our role is to contact the individual and gather information. So a lot of times, depending on the disease, it could vary on the questions, but basically what we want to know is, did you have any symptoms, yes or no? If yes, when did they start? What were they? When did they end? Did you travel recently? What's your vaccine history? Any close contacts? And so that's the type of information that we're gathering for the state. I think that is it. I just also wanted to mention that we have a really wonderful relationship with Cape Cod Tech in Harwich. We work very closely with them, with their health tech students specifically, and also their dental students. We set up clinics, pop-up health clinics with them all throughout the Cape. They come and shadow us at vaccine clinics and blood pressure clinics. We also, at the end of the year, the last 2 years, at the end of the school year, we set up like a career, not a career fair, what do they call it? A shop fair or an academy fair. So all of the different shops come and kind of put on display what they've accomplished that year, what they learned that year. And usually they have something to offer. Like culinary made smoothies, for example, and gave those out. The health tech students do blood pressures, and it's just a really nice way to get the students into the community and engaging with people who aren't like them, you know, aren't young and healthy and vibrant and all the things. So it gives them some diversity as far as practice goes. So that was a really high level, fast, I'm sorry, that was a lot, but high level overview of our public health service for the town of Harwich.
Any questions?
I got some.
Okay.
And all good things, but I'm curious, because not the first time I've seen this paperwork.
Okay.
However, it was just dropped on my desk by one of our navigators at Outer Cape Health Services.
Oh, okay.
I'm the nurse manager there.
Yeah, I thought your name sounded familiar.
And you know, I didn't really know what it is. And we use, the nursing team is the one who makes all of our referrals to you guys. And we use you and many other organizations around, but I certainly didn't know the level of programs that you have for some of these things. I mean, I can see, just looking down these lists, like multiple programs that I can certainly recommend to patients. Now, the question is, well, usually when we're doing referrals, it's for like home nursing, PT, OT. But like,
Right.
if I had somebody who was suffering from arthritis and wanted to arthritis, could we send you just like a face sheet? Even, would it need like an office visit even
Yeah,
if it
we
was
don't
just
need
like a
orders or
patient that we've
anything.
been talking to
Yep.
over?
Yep, because it's not insurance driven, it's all
I-
paid for by the town.
The aquatic conditioning, so they
Yeah.
would have to be,
So
would
they
they
would
have to be
a
in
resident.
Harwich?
No, I mean, we have contracts with every town except for Barnstable, so as long as,
Okay.
you know, we would, depending on the town too, because we don't offer aquatic conditioning, for example, in every town.
But it would be something
a
they
pool,
could call
we're
you and
interested.
ask. That's okay? I mean,
Let me know.
So where did they do the aquatics for the seniors in this area?
In this area, we have, it's seasonal, but in the summertime, they just started this week, actually. We have a couple programs at the Brewster Sea camps.
Okay,
Yeah.
so that would be Brewster residents.
Correct, yeah, because it's being paid for by the town. We do have an ongoing program in Falmouth at Atria, Woodbriar. That one goes on year-round, and it's got a wait list of like 50 people. It's so popular. And so one of our exercise physiologists is also has certifications in prenatal aquatic conditioning. That's something we really want to get going that we haven't been able to do yet. I don't know if there's any place around here that might be open to that.
Would there be like a a further breakdown of like which towns these individual programs are available in? Because I'll tell you, the aquatic, I have people asking me that all the time.
Yeah.
And we don't have much in the way to offer people, and it may just be Brewster, but it's
Something,
it's definitely a town that we have plenty of people living in.
So, I included in your packet, we send out monthly emails on what programs we have going on in the moment. There's a June 2025, for this area. I send those out monthly. I could include you on, there are people from Outer Cape Health that are on that, distribution, but I could certainly include you
Yeah, it'd be
as
great.
well. Yeah. Mhm.
All right,
I work with Rick a lot. He refers a lot of homebound
Sugary?
vaccines to me. Yeah.
okay.
He's my friend.
Are your aquatic programs just limited to swimming pools? Or do they have to be lifeguard attended, bodies of
So,
waters? Obviously, I
no.
don't
I
think
mean, we're-
marine would be appropriate, but like some of the local ponds if we had.
yeah, we actually explored that option in Wellfleet, and it didn't come to fruition. I'm not sure why, but, I think that we would be open to it. You would have to talk to the exercise physiologist who's very passionate about this. I think the problem with that is it has to be heat controlled is ideal. For exercise, so.
Any more questions? Great. All right. Thank you.
All right, thank you.
Thank you, Meg.
Okay, thanks.
Minutes of the previous meeting? Any additions or subtractions?
I don't think I heard anything on that. I'm good.
Nothing, I move to accept the minutes, for last month's meeting on the,
I don't see the month.
it says day, month, date,
Yeah, and we don't have the month on
Oh,
there.
geez, sorry, that was May
We-
22nd.
May 22nd, okay.
Okay,
I was
okay.
gonna, like, I'm trying to think of
I
exactly
will
which day it was.
revise that.
With that revision.
Yeah.
Down at the bottom, it's down there.
Second.
Oh, it is down there at the bottom, all right. Vote,
Aye.
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 Oh, she can't vote on that one. All right.
Well, she was there.
Yeah, she attended the meeting.
Yeah, she
was
couldn't
there.
vote last
Couldn't
time, but
vote.
she can
You
this
can
time.
vote on anything, but yeah,
Okay,
exactly.
okay, you can vote.
So the well discussion,
Yes.
unless she watched everything from previous,
Okay,
Janet can't vote on. So
Okay.
the next item would be,
okay.
Continued discussion from May 22nd, Board of Health meeting, revisions to regulations for private wells.
Okay. I have some things that I'd like to bring up. One, it's not, top of page says water quality.
everything with the yellow highlights.
Yes. I think and I think Kevin was the one that brought it up, that we had talked about 5 years instead of 10. So I'd like to, I think we agreed to that.
Yes.
And then I saw over on the next page where it isn't yellowed, but again, there's a 10-year over there. In number 6. And then, oh, wait,
Want to make that 5 years?
yes, yeah, because that would fall in line then with, you know,
Yeah.
the other one. There was another,
In the next page under existing wells, I think you had,
yeah, no, wait,
we had missed some alterations.
yes, all right. Why can't I find existing wells?
It's after the highlighted page.
After the highlighted page. All right.
And on the right side.
Existing wells. Oh, I do have it written out. All right. Where it says, Number two, under existing wells. The results of all water quality tests shall, where it's saying shall be made available. I think I had requested that, what was the word we were using? The,
Shall be supplied.
shall be supplied. In other words, instead of making it that the owner doesn't, it's up to
You
him
can
to.
say it's available and just nobody asked for it. It was available the
Yeah,
whole
and
time.
nobody asked me, so
Yeah,
I'm saying that
testing
they,
it,
that they
give
need to
them.
give it.
I would
They-
agree.
They need to give that. And I don't know if that was the only, was there any place when I read through this that I saw that?
That's the only place it's noted.
That it's noted, all right. But I'd like to see that as, yeah. Other than that, I didn't have any. Anybody else?
So if the board is ready, you can move to adopt these with the noted revisions.
With the noted revisions. Okay, you want to make a motion, somebody?
I move to accept the regulations for private wells with the revisions that the regulations for every 10 years for testing be changed to every 5 years. And the phrasing of the existing wells serving rental properties, section 2, for results of water quality testing being made available shall be changed to shall be supplied to all tenants of the property and to the Board of Health by the owner of the property.
Second.
Vote?
Aye.
Aye.
Aye?
Oh, she,
Yeah, can't.
that one she can't vote, okay.
Very good.
All right.
Do you want to add an effective date to that as well?
Effective
Can we make
today.
it today's date?
You can make it today's date.
That would make sense.
Today's date.
All right.
New business,
Yes.
FY '26.
Yeah.
Contract, review and vote to submit to Board of Selectmen for approval signature.
Was, okay, I'm out of order.
New business.
So this is renewing the contract that, for the services that Meg just presented it to us.
Motion, anybody?
I move to accept the contract with the VNA as outlined by Meg Payne in her presentation.
Second.
Oh.
Aye.
Aye.
Aye?
B, variance request for dog-friendly space, Kirk's Coffee Shop and Beer Garden, 545 Route 28, 105 CR 590, Chapter 6, Section 501, 1.115, paragraph.
Excuse me, I'd like to object to, or to consideration of this matter.
What did she say?
Can you hear me?
Yes, we can. Can you
My name
identify
is,
yourself?
I'm Attorney Dina Brown,
Yeah.
and I represent a couple of the abutters, and they did not receive notice for this hearing. And we would like it to be continued till the time that they actually have notice so that they could prepare and attend.
So that was oversight on my end. For the approval, I had copied and pasted the Title V variance notice, and I meant to remove those, but it didn't get removed on the approval, but we did not make them notify abutters. So the board, where we have an objection, we can either move to bring this back to amend that for next time, or if the board wants notification of abutters, we can have the applicant notify abutters.
Well, she seems to think there's some people that want to,
We can
Yeah,
continue
so
it.
We can
the
continue.
original approval required the abutter notification, but
Right.
that was oversight on my end to not, because it's not required in the state food
Okay.
code to notify abutters, but the approval that you saw did have that requirement.
all right.
So we can do one of two things, to either continue it with a butter notification or bring it back next month to make any modifications if you don't feel a butter notifications is
I think we
required.
should have the abutters, I think we
Yeah.
should have that continued.
Yeah, I agree.
Is that, can I ask a question?
Mhm.
Taylor Powell, Island Park,
Yep.
Sure. My name's Taylor Powell. I own the establishment that's asking for this variance. So I have two questions. Who are the butters that are concerned about this? What are their names or the names of the places or people that have hired you?
So that, I mean, she can absolutely answer, but may be irrelevant to the issue at hand. It was oversight on our department to
Okay.
remove that requirement without consulting the board.
Well, let's
We
see if she
didn't-
wants to answer. I mean, maybe,
They're your direct abutters.
okay. Yeah, Second
That's
question
all
would be
I'm
to the board, so I've heard enough there. Do we have to have someone object to this? Can we continue, like,
So based on the filing requirements, they do have a legal objection because we didn't make you notify abutters. We just felt that it wasn't part of the food code, but it did get approved by the board to have that, so we should have had you notified abutters. I shouldn't have taken it upon myself to make that decision internally, that abutter notification wasn't required.
okay?
Okay.
Carrie, Cindy Williams, Harwich Chamber. Can I just ask a quick question?
Yes,
When is the next meeting scheduled?
July 15th.
Have you had any other local outdoor restaurants start to put paperwork through?
No.
Okay.
So my apologies
you.
for the delay.
I
This
just don't
was-
know why this requires an abutter. This is like a federal thing that's been approved in the country. I
Well,
don't know
it's-
why a neighbor would have a say in my application whatsoever.
Because of the way the board approved the application process, I didn't take that off before I brought it to the board. It was oversight on my end, but because the board did approve it with those requirements, it is now a
So,
required notification.
if I may, it was on there when we approved it because you didn't take it off even though, so we did approve a version that had the abutters requirements on it. Can we acknowledge that as an oversight? Also make the change that it is,
Not until it's reposted for amendments.
okay. How soon could we do that?
Right.
So it would be next month, but we could,
We could
in
take
theory,
the-
take that, understand that there was an error on the, part of the Board of Health for that, but we could also amend that to say that in the future, there is no requirement for notification
Yeah, but-
of the abutters.
In order for this to be continued to next month, a butter notification would need to be sent out to complete his application
Because
because it's
it's
not
Understood,
modified yet.
because it was on when the application came through.
I think you're referring to the ones that are going to be going
In the future,
Forward.
so like, if, with that in mind, that being said, so if we can't change it until July, any applications that would come in between now and July would need to
Up.
inform the abutters, just because that's what was approved, but I would like to take that out, if we could put that on the docket for July. Do we need to vote on that, or can we just,
You can request for it to be placed on for revisions
I,
for the agenda.
Kevin, can I interrupt again? Sorry.
sure?
I think it's only fair that if we're gonna have this one business have to have abutters, we need to keep it for everybody for this one. That would be my suggestion, so it's a fair playing field for everybody.
So there is some kind of internal talk on the impact to abutters. Some people feel like the impact is to the business itself and doesn't impact surrounding businesses. It's not required by the FDA code for variances, abutter notification. Some people feel like the direct businesses are impacted. It's really up to the board on whether you feel. My personal opinion was that it was affecting the business and not the abutters, businesses. so
I would agree with you on that, Carrie, but I think moving forward, it's only fair for this first business if everybody moving forward has the same thing on theirs.
I understand what you're saying, fairness. If one has to,
Yep.
they all have to.
Yep.
On the other hand, this was a one, if you're saying a butter notice isn't needed, although I think it is, because the FDA regulations defer to the local Board of Health, and your local Board of Health requires that any variance give notice to abutters.
Is this really a variance?
It's
That's the
a
application was for a
FDA food
variance.
variance, but I don't know where our regulations say that a butter notification is required, except for the outline that we provided. Where else in our regulations does it require a butter notification?
Well, on the variance form itself.
Yeah, but
Yeah.
that's what they approved last month, where they have the ability to modify if they,
I think maybe what she's getting at is the variances that we sometimes have for somebody that's, like for septic systems. or-
right, but that's
Yes,
required, that's
all of the
required by the
Board of Health.
state sanitary code as
Yeah.
well.
Yeah,
So this was kind of,
Now,
us taking that form out of the
it
state
does feel a
sanitary
little
code.
bit like just an attempt for a giant wrench. If they had enough time to notify you and you're here, they could be here to speak tonight.
That is not true. What,
You're
people are
here.
out of town. I am actually in Boston. I rushed home with this on my phone.
They could be online as well. They could be here.
I'm sorry?
They could be here. They could be online as well. You are.
I had
Just
to
pointing it
rearrange
out.
my schedule without getting proper notice. The reason people get notice is that so that they can attend. If they have prior plans or aren't available, that's not a fair position to take. Notice is required for a reason, and it's not one-day notice. It's so that people can make sure that they are either present or available to log on. As I said, I had to rearrange my schedule like crazy to get to this tonight. I only heard about it today. So if we're gonna do notice, notice has to be done right, and that's what I'm requesting.
So what we can do, if the board would like, is to continue this with notification of abutters, and my apologies for my error on my end, holding up your
Million errors.
process.
I think you're doing a great job.
And then we could put it back on the agenda for further discussion, to have all the board members here and present to discuss if a butter notification is required in the future.
yeah.
I mean, one more time, just to reiterate what I said before. If we're able to vote legally and carry this on, I'd like to continue with my application. The lawyer's there to throw mud at us. They could throw mud during the meeting all they want and continue. And if you guys are cool with it, let's go,
We
because
can-
we're here.
We can continue it with a complete application with the butter notification. If that's how the board chooses, you can withdraw your application and reapply, but where the fees are paid, I feel like it's fair to continue it where it's our error or my error.
Yeah, certainly. I don't
them.
want to have, there should be no additional fee. I think you're asking if we can proceed with a vote tonight.
Yeah, let's go.
And I,
No,
No,
as
we
much
can't.
as I'd like to, I don't think we
Unfortunately,
can.
We can't.
yeah.
Um,
Yeah, unfortunately.
But, yeah, 100%, there should be, he shouldn't have to rescind or
Okay,
pull
well,
back any
then I'd like to
application.
apologize to the board for, I guess, my neighbors, because they're not friendly. And this isn't the first time they've hired
Let's
lawyers
not
to
go
try
in
to
that
stop me,
case.
and then also,
We
it's
have to
just-
hear them out. It doesn't mean
Yeah, I get
that
it.
they're going to have any sway
We'll see 'em-
over
we'll
the
see 'em on
vote
the
that
15th.
occurs. So we'll see you next month.
yeah, we'll
and
see them on the 15th.
We'll do it again.
Can I jump in for a second?
Sure.
You can get up to the mic and introduce yourself.
So this is regarding Taylor, but let's look at the big picture. Why not approve a variance for all restaurants that have outside without approvals? Because.
Just introduce yourself,
Oh,
sorry.
I'm Walter Mason.
Yep.
Okay. So my theory is, I was at this, we tried to get this passed 3 years ago. I came before the board saying, let's do this, not just for him, for all restaurants, to do this, because he should be commended. He's trying to come under the Board of Health purview, following your requirements to have dogs or mini horses, because they allow them, in establishments, okay? In his establishment. But the other places that don't apply don't have to come under your rules. Sure, they can't have dogs, but you know the service dog requirement, or, that out that they get is
Service
because.
dog? That service dog.
It's separate.
That's totally separate. Let's
But
not
that's
even
all
go
they
there.
have to say is, it's a service animal.
No, actually, every establishment, if somebody brings in for a service animal, they need to be specifically licensed and gone through trainings.
No, they do not. Here's Massachusetts law.
to be-
It says right here, there's two things you can ask a dog owner. Is a dog a service animal required because of a disability? They could say yes. What task has a dog been trained to perform? You know,
There are
public speaking,
unfortunately
you know?
people who take advantage of that lenient requirement for service animals, and we do appreciate people trying to come forward and follow the health requirements. We can't do a blanket approval because every establishment is different and is set up differently, so we want to see them on a
No, they only
case-by-case
they only can
basis.
have it if they meet all your
No.
requirements. So then when you go and inspect them, you'll be on your checklist, they check this, okay, you can have it. If they can't, they have to put a sign up that says, no dogs allowed, or no service animal.
pets, no
You know,
pets.
no pets, okay, allowed in this establishment. But everybody else, if you meet those tests, you're okay.
It has to in line with certain health standards, and that's what we're looking at.
So it makes
why
it
we
safer
wanna
for the
look
town,
at-
for everybody, because now these places that allowing dogs that aren't have to go by the list and are unsafe, they don't have a can, they don't have sprays and so forth, they will now have to have that if there's a dog on the premises, and they can be caught otherwise. So I think you should just open it up, not make it just him in particular. You know, that's my theory, but that's what's.
Gary, if
No,
I
no.
could jump in again, since I was at the meeting, you all did an amazing job on the guidelines and the checklist. I would also like to commend Taylor and his wife for coming forward and doing a great floor plan. I think what we should do, in light of everything that happened tonight, is continue to the next meeting, but also, I'm gonna stress that it has to be a fair playing game for everybody. You can't just blanket it, unfortunately. Walter, I sat in, they did a great job on what we could do and can't do, because there are outdoor restaurants that will not be able to do this. They're just not set up for it.
Right, so
But
they post a sign
what-
that says no dogs allowed, no service.
Yep,
pets.
we're already
Not service
working
pets, no
on,
pets.
the plaques and everything for those that will be approved. But, it's a tough thing tonight, unfortunately, but I think, they've got a good plan, and we just need to, wait until the 15th.
And again, my
And
apologies
what I
for
would say
you and.
is,
and
what I would
wasting
just
your
say
time.
in closing is that the very reason, they may have a good plan and we may all support it, but we have not seen the plan. So,
It's in the packet that we all saw online.
well, the abutters didn't get it.
Well, we
All right.
can't beat a dead horse, so.
So, I, request to have the variance regulations come back so that we can remove the notice of the abutters. I understand your desire, Cindy, to have it be fair for everybody. I think it would have been had somebody not come through tonight with a complaint. I think it would have been handled the same way. I would still would like to change it. I apologize for the inconvenience to you, Taylor, sorry. It's unfortunate. Again, certainly don't want you to have to rescind anything. There shouldn't be any additional fees. So as far as this specific variance request for Perks Coffee Shop, I move to continue it to next month, July 15th, and have it come back with proper notice to abutters.
Second.
So Kevin, if I could just ask where you're going to do that, and you want to have for future things, the abutters notice not on the checklist. When Taylor comes back on the 15th,
And
the
it's
abutters now
unfortunate-
know about this meeting coming forth on the 15th. Is he going to have to notify all the abutters and
Yes,
have
because
to go?
it's a continuance for an incomplete application. At this
And if
All right.
anybody applies between now and the time we have to change it, they will have to notify the abutters. But,
Okay.
I mean, if this is gonna be something that applications are gonna come in year after year, new businesses change over all the time here, I think that this is something well under the purview of the health department to determine whether something has fulfilled all the requirements. And I think we have great requirements set in place that Taylor did a wonderful job of meeting, and certainly, I think we would have approved it tonight. So I think we can safely remove those from the variance application and leave this under the purview of the Board of Health.
So we can bring that back for discussion with the full board as to any changes for that, and you can vote to continue. So we'll get that back on the agenda. That does not require a vote. And then the vote for continuance needs to be moved and seconded and voted if that's the
I
way you wish to proceed.
move for continuance of the variance for Perks Coffee Shop to July 15th.
Second.
Vote?
Aye.
Aye?
Aye.
All right, thank you, guys.
All right, thanks.
Thank you, everyone.
Thank you very much.
Thank you.
Oh, so this has to do with the fees then. Okay. Next.
I'm sorry. It's the Health Director.
Report.
Proposed updates for FY '26 Board of Health fee schedule.
Yes.
Okay, so that's gonna be, all these places, name them all, or we should just,
No, so this is your fee schedule for FY '26. Nothing is changing.
Except the highlighted ones in the back.
Except the addition of the dog-friendly hearing fee, and a pre-occupancy housing inspection. So we've been getting some requests for voucher programs for us to come in and do a pre-occupancy inspection to confirm that there's no violations. So it's a service provided for voucher programs, so we thought it would be appropriate to charge a fee for that inspection.
I move to accept the fee schedule for the Board of Health as presented today, June 17th, with the new additions of the $125 for a dog-friendly space hearing for the Board of Health and the $100 housing inspection, pre-occupancy housing inspection for rentals.
second. Vote? Aye.
Aye.
Aye?
Done it?
Okay.
Aye, okay.
Now we have the report of Health Director, sorry about that.
Yep.
So you have to realize we speak at the same time, they don't hear you because I'm too loud. That's why I moved this back as soon as I got here.
We have our community action plan, which is being finalized in response to our public health needs assessment. We have been working with Crescendo Consulting to create a community action plan, and they will be presenting to you at the July 15th, 2025 meeting. Sewer connection letters for Phase 2 property owners will be going out this month. You may start to see these properties on the agenda to discuss noncompliance. We will start off with a first notice, followed by a second notice, and if we do not receive any communication, we will begin to call property owners in front of the board to discuss. Our 204 Market Days, the Health Department will have a table set up at the 204 Market starting July 3rd. The market runs July 3rd through August 28th on Thursday evenings from 3 p.m. to 6 p.m. At the Cultural Center, we will have a table to engage the public on various health topics as they arise during the summer, and have invited the following community partners out to join us: Barnstable County nurses to talk sun safety, Barnstable County educator to talk tick bite prevention, Cape Cod mosquito control, the VNA topic to be determined, and there will be a master gardener there every week except for the first, that you can ask any garden question you might have. A full schedule can be found on our website.
I have to go pick a brain.
Correspondence is none,
None.
and then permits.
Permits.
Not much.
So, the farmer's market is gonna be, what's it, Thursday night? From 5 to,
3 to 6
3 to 6, I'm
at the
sorry,
cultural
3 to 6,
center on the front lawn.
right, okay.
Gotta stop home from work.
We'll be there every week.
That's right in the corner of, right in the,
Any questions about the 4 permits?
okay, no, I'm just trying to locate it, just to make sure.
Yeah, across
Oh,
from
yeah.
the
Yeah,
public safety building.
very good, okay, very good, okay.
Is that the police and fire station? Is that the public safety building?
It's the public safety building.
Yeah, it's still the police and fire station up here, you know, but, okay. I move to accept the new licenses, the permits that are listed here.
Second, vote? Aye,
Aye.
Aye?
I,
There you go.
very good, okay. Very good, and then to adjourn?
Move to adjourn.
Second, vote? Yes, aye,
Yes,
Aye.
okay,
all right.
Right.
okay.